Oral anti-diabetic drugs. Type 1 diabetes is a disease caused by the lack of insulin. Insulin must be used in type 1, which must be injected. Type 2 diabetes is a disease of insulin resistance by cells. Type 2 diabetes is the most common type of diabetes. Treatments include 1. Agents that increase the amount of insulin secreted by the pancreas. 2. Agents that increase the sensitivity of target organs to insulin. 3. Agents that decrease the rate at which glucose is absorbed from the gastrointestinal tract. Classification: biguanide sulfonylure eas meglitinides thiazolidinediones dipeptidyl peptidase 4 DPP4 inhibitors, sodium glucose cotransporter SGLT2 inhibitors, alpha glucosidase inhibitors. Biguanide. Example: metformin mechanism of action lowers blood glucose levels primarily by decreasing the amount of glucose produced by the liver. Metformin also helps lower blood glucose levels by making muscle tissue more sensitive to insulin so glucose can be used for energy. Sulfonylure as example: glimepiride, gliclazide, gliburide, chlorpropamide. Mechanism of action: increase insulin secretion from pancreatic B cells. Meglitinides. Example: nataglinide, repaglinide. Mechanism of action: increase insulin secretion from pancreatic B cells. Thiazolidinediones. Example: rosiglitazone, pioglitazone. Mechanism of action: these drugs help insulin work better in the muscle and fat and reduce glucose production in the liver, lowers blood glucose without having a high risk for causing low blood glucose. Dipeptidyl peptidase 4 DPP4 inhibitors. Example: linagliptin, sitagliptin. Mechanism of action: they work by preventing the breakdown of naturally occurring hormones in the body, GLP-1 and GIP. By interfering in the process that breaks down GLP-1 and GIP, DPP4 inhibitors allow these hormones to remain active in the body longer, lowering blood glucose levels only when they are elevated. Sodium glucose cotransporter SGLT2 inhibitors. Example: bexigliflozin, canagliflozin, dapagliflozin, empagliflozin. Mechanism of action: sodium glucose cotransporter 2, SGLT2, works in the kidney to reabsorb glucose, and a new class of medication, SGLT2 inhibitors, block this action, causing excess glucose to be eliminated in the urine. Alpha glucosidase inhibitors. Example: acarbose, miglatol. Mechanism of action: reduce intestinal glucose absorption. Thank you. For more nursing-related videos, please subscribe, like, and press bell icon.